Welcome to another easy nursing review. In this lesson, we will cover Pheochromocytma. Before we begin, which information is a risk factor for developing Pheochromocytma? 1. A history of skin cancer. 2. A history of high blood pressure. 3. A family history of adrenal tumors. 4. A family history of migraine headaches. Find the answer at the end of this video. Now let's begin by first learning what Pheochromocytma is. A tumor on the adrenal medulla secretes excessive amounts of epinephrine and norepinephrine. It occurs at any age, but peak incidence is between 40 and 50 years of age. It affects men and women equally and has familial tendencies. 10% of the tumors are bilateral and 10% are malignant. Now, let's go over the signs and symptoms of the patient. Here are the following signs of symptoms. Uncontrollable hypertension as a result from increased epinephrine and norepinephrine. Headaches as a result of hypertension. Palpitations and tachycardia due to increased production of catecholamines. Dilated pupils from increased production of epinephrine and norepinephrine. Now, let's go over important labs and diagnostics. Presence of catecholamines in serum. Increased catecholamines, metanephrines, and vanillomandelic acid in 24-hour urine collection. Presence of adrenal tumor shown in CT scan. Okay, let's move on and learn about treatments for Pheochromocytma. The main treatment is surgery. There will need to be a surgical removal of the adrenal tumor. Now knowing that, here are the medications used for a patient with Pheochromocytma. Administer antihypertensive medication to help lower blood pressure. Administer beta blockers to diminish effects of epinephrine and norepinephrine. Excellent! Now let's move on to nursing actions. The nursing actions include the following. Monitor blood pressure. Administer medication to control hypertension. Monitor urine for catecholamines. Decrease stress. And with nursing action comes patient education. Teach the patient to quit smoking to help lower blood pressure, and reduce caffeine to help lower blood pressure. Alright, well you made it to the end of the video. Back to that question at the very beginning of the video. Which information is a risk factor for developing Pheochromocytma? 1. A history of skin cancer. 2. A history of high blood pressure. 3. A family history of adrenal tumors. 4. A family history of migraine headaches. Let's see if you got it correct. The answer is 3. A family history of adrenal tumors. There is a high incidence of Pheochromocytomas in family members with adrenal tumors, and the von Hippel-Lindau gene is thought to be a primary cause. Bonus nursing exam tips. Here are the must-knows for nursing exams about this topic. Urine collection should start at the beginning of a hypertensive episode. The typical triad of symptoms is headache, diaphoresis, and palpitations in the patient with hypertension. Well, that ends this lesson. Subscribe for more videos like this.